So welcome back to this lecture on patient-centred care, supporting adherence. And now we'll carry on to part 2 of this lecture. So in the first lecture, we looked at what medication non-adherence is and some of the reasons. And in this part, we're going to continue with the reasons for non-adherence and how as pharmacists we can support patients to take their medication better. So there are quite a few different reasons for non-adherence. It can be something, as mentioned previously in part 1, that the side effects are really unpleasant for patients, and so they'd rather feel ill than experience the side effects. Some people may just simply forget to take their medicines and just find it difficult to remember to take it at the same time every day. Frequency, so if patients have to take their medication very frequently, it can be difficult to remember. Some antibiotics may have to be taken 4 times a day, and that can be quite difficult to fit into a busy day. But also medication not being frequent can be a problem. So some medications may need to be taken once a week, and that can be just as difficult to remember to take as something that's taken very often. Some medication can be really inconvenient. So, for instance, taking an antibiotic such as doxycycline, which causes photosensitivity, patients have to avoid sunlight. Also, doxycycline and other tetracycline antibiotics, you have to avoid dairy products whilst you're taking it. And for antibiotics such as metronidazole, you have to avoid drinking alcohol at the same time. So some of those things are just really inconvenient and would be reasons that patients would not take their medication properly. Some medicines taste really horrible, or they might smell really horrible, particularly some liquids. Patients may have difficulty in swallowing their medication, so that makes it more likely that they won't follow the regimen properly. Some patients don't trust healthcare professionals, and we know that with the social media and conspiracy theories and different things now that's kind of spread on the internet, that there can be less trust in healthcare professionals and scientists. Some patients are in denial, so actually they just kind of won't accept that they're ill, there's something wrong, and that they need to have treatment. Some patients don't really believe it will help. It's a little bit similar to not trusting healthcare professionals, but they don't see that taking a tablet every day is going to help something that's been going on for years. Some patients might think that they've taken their medication for a couple of weeks and so they feel better, so they don't need to take it anymore because they think they've been cured. Some patients may not care about getting better, so they may be depressed. Low mood can affect patients' ability to self-care, and amongst those things would be counter to treatment, and so they may decide not to take it or just may not be bothered about taking it. Some patients fear becoming dependent on medication, although that tends to be unlikely when it's used for a specific medical condition, but understandably, some people are fearful of taking things like painkillers because they think they might get addicted. Patients that have to pay for their prescriptions may worry about the cost. Fortunately, in the UK, a lot of people are exempt from paying for prescriptions, and those that do pay the flat fee for each item. But that can still be difficult for some people that don't qualify for exemption but are still on a relatively low income. And some patients may not understand how to take their medicine properly. It may not have been explained to them properly, or it may be particularly complicated. And so not understanding means that they're not able to take it absolutely correctly. So an example of not understanding, we've got a version here of instructions on how to take lactulose liquid or sachets. This is a laxative. It's also not particularly pleasant to take. The liquid is very sweet and kind of gloopy, so it's a bit unpleasant to handle and to take. But also, if you have a look at these instructions, there's quite a lot of information here. Some of it could be a little bit confusing, maybe a bit contradictory. For instance, the sentence about during the treatment with laxatives, you should drink sufficient amounts of fluids. That could be potentially a little bit confusing. I think if it said during treatment with lactulose, you should drink sufficient amounts of fluids, may make it a bit clearer. And then we've got the dosing, and it's actually dosing for 2 different products. But this could be a bit confusing for some patients if they've been given the liquid or the sachets, but they've got instructions for both. Some patients could get a bit confused. And then the instructions see thereafter the dose can be reduced individually. Well, how do patients really understand how to reduce that? You'd have to explain this to somebody quite carefully to make sure that they fully understand the instructions, because it's not really written in a great way.
So there are 2 main types of non-adherence: unintentional non-adherence, where the patient does not mean to take the medicine incorrectly. So they may forget to take a dose, maybe they can't open the packaging, or they can't pop the tablets out of a blister pack. Maybe they're having trouble swallowing the medicine, or maybe, as we looked at with the lactulose in the previous slide, they don't understand the instructions. They're too complicated, they haven't been explained well enough, and so they actually just don't take the medicine properly. There's also intentional non-adherence. So this is where the patient has made a conscious decision to not follow the recommendations for the treatment. So they may think that, well, actually, I don't need to take 2 tablets of this medicine. I'm just going to take 1 today. Or maybe they think, oh, well, surely if I take more of it, it will do me more good, so I'm going to take 2 instead of 1. They may decide to just stop taking the medicine to see what happens. They've not noticed any difference, so they think, well, it doesn't seem to make any difference. I'll just stop it, see what happens. I seem to feel fine without it. They may have lots of different medicines and be maybe overcome by them all, or feel that they just don't want to take that many. So they may decide to take some of their medicines but not others. So choose maybe to take the medicines for which they can feel the symptoms, and not take medicines for illnesses where they're not aware of the symptoms. And they could also do something like substitute a non-prescribed treatment, maybe an alternative remedy, instead of taking prescribed medicine. So as you can see, these are all conscious decisions, therefore it's termed as intentional non-adherence.
So it can be useful to consider the necessity concerns framework to understand why people may choose to be non-adherent. And it comes down to the beliefs about the treatment that an individual patient has. So the necessity concerns framework postulates that adherence is influenced by implicit judgments of personal need for the treatment. So that's in the green box on the left, necessity. For instance, a diabetic patient understanding or knowing how much they need the medicine, or having doubts about how much they need to take the medicine. And then their concerns about potential adverse effects of taking their medication. So you can see here it's on a scale, and if their doubts about the personal necessity and their concerns are heavier or more than their realization of the necessity to take the medication, then they're more likely to be low adherent. So patient beliefs have a big impact on adherence, and you'll be learning about that elsewhere as well in other lectures. A lot of patients want to minimise their medicine intake whenever possible. Reasons for this can be to reduce the side effects. If they're worried about addiction, they don't want to take medicine so they don't get addicted. They may choose to take something less often because it makes it easier and the regimen more acceptable. As we saw before, some patients have financial worries about paying for prescriptions. They may be concerned that their medicines are not working. They might not like the medicines prescribed for them for a variety of reasons. They may have read about them in the press, or that it might taste bad, or it might make them feel unwell. Some patients prefer branded medicines to generic because they think a brand will work better. And they may have heard rumours or misinformation about their medication, which makes them think that it's not very safe to take. So there's been research done on non-adherence, and we're just going to look at some of the views of patients that have been found in some of this research. So looking at ibuprofen, most patients questioned knew that ibuprofen can cause gastric damage, but they didn't know that there was a risk of using it with antihypertensives and in high blood pressure and things like that. 2/3 of patients don't read the patient information leaflet and the warning instructions. So if that's the case, that makes the information that you provide to a patient even more important. Some patients don't want to know about side effects because it makes them link symptoms with the drug, and that can indeed happen. Ibuprofen can be bought over the counter or OTC. You can buy it in small packs in any shop. You don't need to go to a pharmacy. And so some patients think that because you can buy it in any shop, this medicine is less powerful and more safe. But of course, ibuprofen can be dangerous if it's taken inappropriately. Patients taking over-the-counter medicines are more concerned with the potential benefits than possible risks, again, because they perceive over-the-counter medicines to be safer. Similar research, patients taking simvastatin. I'm not going to go through all of these, you can read them in your own time, but some misapprehensions about patients may have about simvastatin. So for instance, some patients won't realise that taking simvastatin for high cholesterol is a long-term medication. They might think they just take it for a month and then they can stop. Not being clear about what cholesterol readings actually mean. So important to make sure that patients understand the test they're having, what they mean, what the numbers mean. Misinformation through media. Perhaps a patient has read in the paper that after a certain age your cholesterol level's off. So if they reach that age, they think they don't need to take their medication anymore. And some patients may not accept that they need the treatment. So they might think to themselves, if I stop eating certain foods, my cholesterol will come down, so I don't need to take these tablets. And then going on to metformin, a medication used to treat patients who have diabetes, but may not need insulin. So similar question to these patients. So some patients might attempt to adjust the amount of tablets taken. Metformin, it can be quite a lot of tablets per day. So they might think, well, if I eat less, then I don't need to take so many tablets because you take metformin with meals. And perhaps that patients might think, well, if I take the tablets, that might make me ill as well. And so I don't want to take them because there's just as much risk of being ill or dying from taking too many or not taking enough. So you can see with these reasons on the previous slides that actually a lot of the reasons for non-adherence is because patients don't fully understand the reason for their medication and the risk and the benefits of taking it. So as pharmacists, it's really important that we give sufficient information and we give the information in a way that patients will understand. If they have the information, they understand it, it's much easier then to involve patients in decisions about their medication, and involving patients in the discussion, trying to elicit patient beliefs about medication with some careful questioning can help you address those beliefs if some of them are maybe misfounded, and again help with adherence. And also checking up with patients how they're getting on. So, you know, it's not just about giving medication the first time and leaving them to it, but when you see them a month later or a couple of months later for their next prescription, asking them how they're getting on, asking if they're having any trouble with it, any side effects, maybe offering some reassurance about those side effects, and helping them to be happy with what they're taking. As pharmacists as well, in hospital and in the community setting, once patients have been on medication for a while, it would be reviewed. So you may be doing a medicines usage review in community pharmacy and checking whether the patient's still taking it, whether they still need it, whether the dose is appropriate, etc. And then communicating with other healthcare professionals. So if you're doing an MUR, a medicines use review, and you identify problems, ensuring that information is supplied to the patient's prescriber to ensure that all healthcare professionals involved in the patient's care are up to date, and also whether they need to make some adjustments to a patient's treatment. So supporting adherence, there's a number of things that you can do. Or that could be done. So providing information, perhaps looking at changing a dosage regimen. If a medication is normally 3 times a day, perhaps it is possible to reduce it to maybe twice a day, or we could use a different formulation which could reduce the frequency it has to be taken. Using reminders of some kind, so helping patients maybe set an alarm on their mobile phone, giving them a written or printed reminder sheet, that kind of thing can help patients remember. Helping the patients to self-monitor their treatment. So perhaps they're having treatment for blood pressure and they've got a blood pressure machine. So making sure they know how to take that blood pressure and helping them to interpret the results. And also as pharmacists, conducting medication reviews at the appropriate intervals to ensure that everything is still appropriate for the patient. So I mentioned some questioning of patients earlier to find out what's going on with them and with their medication. So you need to remember that it needs to be done in an appropriate fashion. You don't want to be accusatory or appear to be telling them off, because that's in some patients going to make them even more likely to not follow your advice. So some appropriate gentle questioning might be, so tell me, if you do forget to take your medication, what do you do about it? And important to make sure that they are not doubling up with quite a lot of medicines or just taking the appropriate action. You might ask them what prompts you to remember to take your medication. And perhaps if they say, well, I don't really have anything that prompts me, you could help them come up with a solution to that. Looking at their beliefs about the medication, do you think your medication will help you in the long term? If patients don't seem very sure about that, then it's a good opportunity to give them some further information about taking their medicine. So let's go back to our scenario. Mr. Wallier brings in this new prescription for his levothyroxine. And thinking about the things that we've talked about in the lecture and the slides, the reasons for non-adherence, and how you can help with that. We know that the dosing instructions state that it should be taken before breakfast on an empty stomach, 30 minutes before breakfast, caffeine containing liquids and other medication. So that could make it a bit tricky for the patient to take it properly. We've looked at some of the symptoms of his illness. So things like constipation, depression, dry, scaly skin. But then look at some of the side effects. So some of the side effects could be quite similar. So patients may already be feeling depressed, but the tablets could make him feel anxious. So he may be constipated, the tablets could send him the other way and give him diarrhea. He may have dry, scaly skin, but you can also get other skin reactions with levothyroxine. So some of the side effects could be as bad or worse as the symptoms of the illness. So have a think about these questions. Is Mr. Wallier likely to adhere to his treatment? You think yes or no? What evidence would you use to make that decision? Think about evidence that you might use to help him to be adherent. Do you think if he was non-adherent, would it be intentional or non-intentional? And what can you do to support him to be adherent? So it's difficult to say at this time whether he'd be adherent to his treatment. But say he did start taking the tablets and then found that he got side effects. The thing there would be that once the dose has been titrated to the optimal dose for him as an individual, those side effects are actually likely to disappear. Because levothyroxine is a synthetic hormone, the dose can take a little while to get right. We've seen that it takes 3 to 4 weeks to become stable. It can take a while to get the dose correct, and once it is at the right level, those side effects are likely to disappear because it should be mimicking the level of hormone that the patient's body needs to function correctly. So that's one of the key things really with a medication like levothyroxine, that when the dose is right, the side effects should go, but it could take a few weeks or months to get the dose right, so encouraging the patient to be patient with that. So that's the end of the lecture. We've covered the concept of non-adherence to medication. We've looked at the reasons and also how, as pharmacists, we can support patients to adhere to their medication. So really the key things are providing patients with the right information in the right way, and communicating with them clearly to support them in taking their medication properly. So references here, got reference to the simvastatin paper and a link, reference to the metformin paper. Unfortunately, I don't have access to the reference for the ibuprofen data, and then other references for the rest of the lecture. Thank you for listening.